You guys are good to go.
Thank you, Aniela. Good morning, everyone. It is June 25th, 2024, 8:02 a.m. I'm going to call the Board of Health meeting to order. Present, we have board members Frank Ehrlich, Ken Lalim, Janet Karpiak, Joan McNeil, and Norman Weinberger. And we have staff members Bill Mooney, Aniela Fignon, Jalea Green, Brian Weeks, and Megan Bogno. The first item on the agenda is the approval of the May 28th, 2024 meeting minutes. Do I have a motion?
Yes.
We have Frank Ehrlich. Do I have a second?
I'll second it.
Thank you, Joan. Any comments, edits, discussion on the minutes? All right, hearing none, I'll call for a vote. All those in favor say aye.
Aye.
Any opposed? Abstentions? All right, they pass. Thank you, everybody. The next few items on our agenda are policies related to the Environmental Health Division. So we have Bill here today. He's been working with Daniela on these policies. I want to thank both of them and all the environmental health staff that have contributed. The first one is our beach monitoring and closure policy. I want to note that Terry Quell couldn't be here today, but she did pass along some questions and comments. So we'll be looking to incorporate those and we can discuss those. But I think I'm going to pass it to Aniela and Bill to take the first one to give a brief overview of the policy.
Awesome. Bill, did you want to kick it off?
Sure. So good morning, everybody. So we've been testing the beach waters for, gosh, I don't know, probably 30 years now, if not more. We do 15 different sites. It's a total of approximately 25 samples, including blanks and duplicates that we're required to do. So we do that every Monday. We start around 6:30 in the morning with 2 interns that we get for the summer. We take them out for the first couple of weeks with one of our staff so they get used to the route and the methodology. And then those samples come back to the lab, and then we kind of get the paperwork together. They'll run up to the Fairfield Health Department, where there's a courier that picks them up, brings them to the State Health Department. We'll receive the results the following day. And then depending if there's any failures, we'll retest on Wednesday morning doing the same thing. Should that fail again on Thursday, we'll close the beach and then retest again on Friday. The state lab is open on Saturdays, which is nice. So we can do a testing on Friday if we need to, and hopefully get the beach open on Saturday when we get the results back. If not, then we'll have to wait till Monday, but it will remain closed until such time as we get a proper sample that passes the criteria. Again, we have 15 beaches. It takes about 2 hours to do it. And it's been successful. Most of the beaches are private, but we've always felt it was good public health that people are still using the beaches to go ahead and sample them anyway. And the communities really appreciate it. And they're used to it. So they look forward to it. And they're always checking in on it, see how the waters are. So that's the general overview.
And if I can just chime in, this is a combination sort of our former beach sampling policy and our beach closure policy. So now we've just retitled it to beach monitoring and closure to kind of encapsulate all of the information into one policy. So, you know, that they're not in 2 different places. And Bill did a really good job of synthesizing all of that. So thank you so much, Bill.
Thank you, Bill and Aniela. Are there any comments, edits, feedback on this specific policy?
Yes, I have just one quick question. I notice on the sampling sites, Norwalk Yacht Club. I just wonder, what about the Rowayton Yacht Club? They have a small beach and they use it as a beach.
If that's the same one where we do a Rowayton already, that's sample number 11, I believe.
Yes. Yeah. I just wondered if it was close enough in proximity or not.
I think it is. I mean, we sample we really throughout the coastline, and it's a pretty good representative sampling of all the waters.
Okay.
So, yeah, I think it's a fair assumption that it's representative of everything.
Okay. Thank you.
Sure.
Thanks for the question, Frank. Ken, did you have a question? I think you were talking.
Yeah, I was just wondering if you get any pushback, considering that it's a lot of private stuff. And what would you do if you came head to head with somebody that says, "No, I don't. This is my beach. Go away."
Well, that's a good question. I'm not sure what we would do. I mean, I would say, look, we're only doing this for your benefit and for the benefit of your community. And so we've never had, I mean, they actually enjoy it. They like that we're doing it for them. So we haven't had that come up. I guess we're just taking it on a case by case issue. If they should not want it, I'd say, okay, that's fine. We won't do it, but it's just a simple benefit to your community.
Hopefully
And I
we don't
just,
run into that situation.
I'm sorry, what is that, Ken?
I just said, hope we don't run into that situation too often.
No, it's not come up in the 20 odd years I've been doing it.
That's good.
and I'll just add, I think, if it does come up, I think that's where that, just to add that, like, the relationship building and just educating the public about what we're doing and why we're doing it. I think that would go a long way too. Just, letting people know about the program and how beneficial it has been all these years.
Right.
Good opportunity. Yeah.
Yeah, no, it's great. It's good community work. I enjoy it.
Thank you both for those questions. So I'll just say, Terry, she just had some clarifying questions about some of the procedure steps, or she felt like just, we needed some clarification on some of those items. So we can go in and, make those edits. And then she had just said, yeah. So if are there any other questions or feedback on this one? Would you be comfortable if we move to approve this policy with some additional, clarifications based on Terry's questions?
Yes.
Yes. Okay, thank you. So do I have a motion to approve the beach monitoring closure policy with those additions? Thanks, Norman. Do I have a second?
Second.
I think we had several seconds, but I heard Ken first, so I'll put him down. All those in favor, say aye. Aye.
Aye.
Any opposed? Abstentions? All right, that one passes. Thank you, everybody. The next one is the environmental health complaint policy. So I will pass it on to Bill, and Daniela can add some additional comments.
Sure. So the complaint policy, it's a form that we have and a policy that anybody can call in. They can go through the city's website as far as service requests to get a complaint to us. They can do a walk-in. So there's a number of methods for them to get any kind of complaint to us, and they range anywhere from noise complaints to food, sometimes septic sort of thing, failures or possible failures. So it's a good opportunity. There's a lot of different ways for people to get a complaint to us. And we, once I receive them, I'll give that out to either a sanitarian or a housing inspector, depending on the complaint itself. And we'll at least initiate contact within 2 days. Usually it's the same day, but usually within 2 days, we'll initiate contact, set up a time to go see what the problem is, assess it, and then depending on what we find, we'll do a notice of violation and work on rectifying it.
And one of the big differences here, I mean, really not a huge difference to the actual policy, but a change that we've decided to make is that this used to be just our general complaint policy, and we are sectioning this off to be the environmental health complaint policy, and are going to be developing a different complaint policy for anything that is not environmental health related. So, not neighbors kind of, calling in on each other, but rather other kinds of complaints. So that was the big one.
Thanks, Bill. Thanks, Daniela. Is there any feedback or questions about this policy?
No, this one is fine. No.
All right, thanks, Joan. I think Terry had some questions here, but I don't think it was I think it was mostly questions for this one. Is that correct? Feedback from Terry. So we can go in and add some additional information based on some of Terry's questions. So I'll ask, oh, Annie, what were you gonna say?
I was just gonna say, sounds like a plan.
Yeah. Is that okay with the board members if we do the same
Mhm.
thing for this one?
Mhm.
Okay. All right, so ask for do I have a motion to approve the environmental health complaint policy revisions with the addition of answering providing some additional details to answer Terry's questions?
So moved.
All right, Janet, I think was first this time, and then I get a second from Norman. All those in favor, say aye.
Aye.
Any opposed, any abstentions? All right, thank you. Motion passes, thank you. All right, and then the last policy we have is the environmental file system policy. So Bill, take it away.
Sure. So this is pretty easy one. So we have a pretty extensive file system. It's a lot. Most of it's paper. We are transitioning to more digital format, but over the years we have a pretty wide variety of paperwork. So as a result of that, especially with the septic, if file is removed by a sanitarian, and often they may have it for several weeks depending on what's going on. It could be a construction review where we may have to do some soil testing, may require just a new septic, that type of thing. So they'll have the folder for some time. So if somebody else called about it, initially you'd have to search around and find out where it is. So what we ended up doing was creating a system where each inspector has their name on basically a red folder, and there's a number of them in a separate file. It's taken out with their name. It's slipped in when they pull the file out, the address, whatever it may be. They'll slip it in, and then in back of each of their desks, they'll have a number of files that they can put in. And so you can go in, if you're looking for something, or it's a separate question, and you find the red file, just go to that inspector, you can find it. So it made retrieving the information a lot easier and simplified it. And that way we're not wasting time trying to figure out who's got it and that sort of thing. So that was the basic premise behind doing it. I think I got everything, right? Is that it?
Yes, and we brought this
Thanks.
originally in February, and we've gotten some great feedback from you all and Terry, letting us know that there was a little bit too much history, perhaps, in the actual body of the policy. So we ended up creating Appendix A to just supplement as just a historical record of how we arrived at the policy and the system itself. So that's where we are.
I think I had a kind of comment in general was there's an awful lot of basic information in here. I mean, to put a policy in place that says when something's broken, we'll fix it. I don't know if there's a simpler way to do it. It certainly doesn't hurt to have that kind of depth, but it was a little overkill, I think.
Mhm.
Thanks, Ken.
I have
And-
a question that's not about the content of the policy. Where does the health department stand at this point in converting to a digital format for files? One only has to look at the New York Police Department and what a fire costs them.
So Frank, that's a great question. We are in the process, the city is in the process of looking at a new permitting software for all the different departments. And so we're part of that. And so they just, they're going to be contracting with a consultant to help map out the different procedures and processes for each of the departments to then develop an RFP to seek out a company to do that. So we're getting closer. And so that's going to be one of the things that we talk about with the consultant. We do have a lot of information in a database, a lot of historical information, but it's some of the large septic files. Bill can talk more about it, but we're in the process of figuring out which vendor we're going to be using to then scan everything that's not already scanned in.
Okay, thank you.
So related to Ken's comment too, I know we're trying to pull a lot of like some of that specific information and putting in appendices so that it's not if we need to update something, if something like, or like so that we don't need to have all of that detail in the policy, but can you make a good point? We should be looking at all of these policies with that framework in mind so that we're not putting unnecessary details and things, or if it's already included in somewhere else.
Yeah, if we have a city with a capital budget to replace furniture or whatever, how is it replicated in a policy somewhere? So not a big deal, just clean things up.
Thanks, Ken. All right, so do I have a motion to approve this policy, the environmental health file system policy, with some additional, cleanup as Ken is talking about? And I think Terry had 2 more questions about this one, but I think one of them was related to like a HIPAA policy that we referenced that we can just clarify that that is our, our own local confidentiality policy. Do you have a motion? Norman, and I think Frank was second on that one. All those in favor, say aye.
Aye.
Opposed, abstentions. All right. Thank you all. And I know we've been sending you lots and lots of policies lately, so I really appreciate you reviewing them, and the staff are working on them. Bill, thank you for these 3, and Yella, as always, thank you for leading us through all of these different policy revisions.
Thank you for the comments.
All right. Next on our agenda, we have Julia Green, who is our health education associate. She works in the community health division. She's been with the health department for 5 years now, Julia?
Yeah, October makes 5 years. 4.5.
Julia started, and I think within her first day, we like pulled her into a flu clinic, and she worked like she was like amazing customer service, like just helping out the public like right away. So she's hit the ground running from her first day. So Julia, thank you for being here today to talk about all the amazing programs that you're helping to lead for the department. So I have your PowerPoint slides, but I don't know if you want me to pull them up or if you wanna do that.
I can pull, if it's okay, I can share my screen so because I
Okay.
know when to click. Okay.
Great.
Let me see. Oh, are you all able to see this?
Yes.
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 Okay. Thanks for introducing me. So like Deanna said, I'm Julia. I sit on the community health division as a health education associate. And I'm going to be talking to you all today about our wonderful programs that we do from community health. Okay, let me just move this over. All right, so I'm going to start off with Fit Kids. This is a great program that, as you can see in the picture, that's myself and the health educator, Kelly Tomlinson. So we do this program in partnership with different partners, which I'll kind of touch on at the end. But this is a 4-week program that we offer for free to children that are from preschool age to 2nd grade. We typically work with preschool, kindergarten, and 1st grade from the cohorts we've done recently. This has relaunched, I believe, in 2022. We started this 2023, we started this program up again. So it's 4 weeks long. It's an hour per session. So we will stop by like the same day each week for 4 consecutive weeks. And we teach the children nutrition education and physical activity. And we do this based off of a curriculum called 5-4-3-2-1 Go. And this curriculum teaches children the importance of staying healthy and what to do to stay healthy. So we teach them that they should have 5 servings of fruits and vegetables every day, 4 cups of water a day, 3 servings of dairy, 2 hours or less of screen time, and 1 hour or more of physical activity. So that's the poster that we're holding up. And then we also discuss My Plate with the different food groups to teach the children about eating all of the different food groups and what foods fall into those food groups. So we go over proteins, grains, dairy, and all of that, fruits and vegetables and all that stuff. So this is a wonderful program. So in the past, we have partnered with Norwalk Public Schools, Carver After School Program, Camp Ellie School Readiness Program, which is a program that is, if you're unaware, intended for children entering kindergarten without previous school experience. So we kind of catch these kids right in the summertime. This is their first time enrolled in something close to school. And then we've also worked with their aftercare program. So they have extended aftercare. So we go into those classrooms as well. And then just preschools. We've worked a lot with Carousel Preschool from last year and this past cohort that we've done. So as you can see, the children are learning in the first top left picture. So they're learning the curriculum, and we follow the curriculum up each week. We go over the poster, and we focus in on one specific area, and then we follow that up by doing an activity with the children. So for instance, during the week that we learn about your 4 cups of water and 3 servings of dairy, we follow that up by having the children put together a skeleton to kind of emphasize the importance of calcium and dairy helping your bones grow. So, and then we do the physical activity portion of each time. So each time we do different activities that the kids absolutely love. So we have obstacle courses that they go through, jump rope, and we really accommodate and adjust our activities based off of how much size we have. So sometimes we're outside and we're able to do a little bit more. And if we're inside, jumping rope, as you can see, Kelly and I are holding the jump rope to help the kids through. So they're really actually getting that physical activity and doing fun activities through this program. Just a little bit of data and background. So that's the skeleton puzzle I was referring to. So we typically have about 15 to 20 children. It just depends on whatever organization we're working with at the time and how many children are in the classroom. So in the 2022-2023 fiscal year, we went to 9 sites, and we evaluate the teachers because a lot of these children are too young. We've tried to evaluate the children and the data isn't as great. But so we evaluate the teachers, and we ask the teachers like how much, because they're working with the children constantly. So we evaluate basically their reporting on how many children could identify 2 or more numbers on the 54321 Go curriculum. And during this cohort, overall, on average, 94% of teachers reported that children could identify 2 or more numbers on the 54321 Go poster, which is a central part of the curriculum. And then this in 2024 so far, we have been at 2 sites, and excuse me, and 100% of teachers reported that children could identify 2 or more numbers on this poster. And a lot of the classrooms have 2 to 3 teachers. So we're getting data from multiple adults that are working with these kids. And then we are also working with Camp Ellie to launch another cohort in July. And usually when we work with Camp Ellie, it's multiple sites. So I think it's typically around 4. So we're hoping to get in there in July and start that cohort as well. Right along, I am going to discuss a little bit about growing gardens, growing health. Does anybody have any questions about Fit Kids before I move along?
No.
Okay.
Nope.
All right. So Growing Gardens, Growing Health is another amazing program. I'm not trying to boast about just because I'm running these programs and helping to run them, but they're truly just amazing programs. And we see our families year after year come back. Some kids from Fit Kids and also families from the garden, and they truly just got a lot out of each program. So Growing Gardens, Growing Health is a gardening program, nutrition education, and cooking program that is free to Norwalk families. So children and parents attend each session. This is not just a thing where you drop your kid off and they learn stuff. this is really a family program. You have to be eligible by having a child enrolled in Norwalk Public Schools, and you have to be eligible for free or reduced price lunch, or at or below 185% of the federal poverty line, because we just want to target a population that would more benefit from this program, if that makes sense. So we offer nutrition education. We partner with UConn, FNEP, and Master Gardeners. So that's Juliana on the bottom left. She works for UConn FNEP, and their staff are mostly consist of registered dietitians. And then that's Heather Paracchio here on the top right, teaching the parents and cooking with them. So we do nutrition education. We split the kids up typically. The children go and do nutrition education for their age and some fun games to get their bodies moving for physical activity, while the parents stay behind in the barn and get nutrition education for themselves as parents. And also they cook. Each week we cook something different to kind of talk them through and show them how you can prepare meals at a lower cost, incorporating fruits and vegetables. So the point of this program is to increase fruit and vegetable consumption. And it's just really a great program. It's super hands-on. So we do the nutrition education and cooking in the first portion of the program. It's about 2 hours. And then the second half, the last hour, we go down to the garden at Fodor Farm, and each family has assigned plots where they garden and literally grow fresh produce from seedling to the fresh produce that you're seeing here. They're able to take home that produce, which is amazing. And the kids are hands-on with that too. And studies have found that if children help you cook and help grow fruits and vegetables, they're more likely to consume it. So that's the point of having everybody involved, a family effort, so that parents can learn. You know, I have a picky eater and I'm having trouble getting them to eat more fruits and vegetables. We teach them through the program how to involve them more and get them more interested, but also maybe how to sneak some stuff in, chop up fruits and vegetables fine into like muffins. We do. And they're like, we do carrot muffins, and they're eating carrots, but in a muffin. They like muffins. So it's really just a win-win for both sides. And like I said, we partner with Master Gardeners, UConn Expanded Food and Nutrition Education Program, which is FNEP, and Norwalk Recreation and Parks Department, which allows us to reserve the space to use at Fodor Farm, the barn space with the beautiful kitchen that was in those pictures, and also these plots. We have 18 plots at Fodor Farm. Each family is assigned their own plot, and then one of the plots is an herb bed that is shared amongst all families. So families are able to get fresh herbs as well as fresh produce that grows. And then volunteers. We have volunteers this year through UConn, and then we've had volunteers in the past through our emergency response team come help and clean out the beds. So we appreciate all people that help with this program, because it's kind of a lot to run it. And those are our families that graduated last year, our great team that we had. And as you can see, some of them are holding some of the produce that they grew in the garden. So that's all of the stuff they grew in their little certificates. So last year we had 9 families complete the program, and we consider a family completing the program as registering and attending majority of the sessions. I believe if there's like 7 sessions, they attended at least 5 of them. And we typically, like I said, this program is to increase fruit and vegetable consumption. So that's something that we evaluate. We do a pre-survey and a post-survey for data. With this group from 2023, we had a high report in the pre-survey of families consuming fruits and vegetables. So we only had an 11% increase because the original data was high. However, we did find that 89% of families had improved overall diet quality, which is cooking more at home, less soda consumption, eating more dark red and orange fruits and vegetables. So the kind of that rainbow of fruits and veggies in 2023. So even though families already reported that they had, they were consuming a lot of fruits and vegetables, overall their diet has improved. So that's amazing. And we are currently running this program and still actively recruiting. But right now we have 10 families enrolled in the program. So we started our first week last week. And tomorrow will be our second week, week 2, and it's going very well so far. All right. Okay. And then my last program that I would like to discuss with you all is our Norwalker program. So this program is basically to increase physical activity amongst Norwalkers. And through the easiest thing and one of the most beneficial forms of exercise, which is walking. So Norwalker, we have walking maps, as you can see in the top left photo that I'm displaying. Those maps are available in English and Spanish and are on our website. They're walking maps that have about, I would say, 2 to 3 routes per map that range in distance. And you can pick different areas in Norwalk and take a map and walk. And we tell you high traffic areas, the history of the area that you're walking in, which is very interesting, and all of that good stuff. So we have paper copies that we hand out at events we go to, when we do community walks, which I'll discuss a little bit next. And then we also have this where you can just pull it up on your phone and use it as you're walking. So that's one part of Norwalker. Another part of Norwalker is our community walks. So sometimes we do use these walking maps that are that we created years ago to host walks. And then sometimes we just partner with other departments or organizations to host walks. And we're very open to hosting additional walks this summer. So if you or anyone that you know or organization is interested in having a walk, we're totally open to it. We love to partner. So we just recently partnered with Norwalk Police Department and Norwalk Public Library, the Sono branch, to host a walk. As you can see on the bottom here on this photo, we had lots of people attend and it was a great walk. It was a short distance. We just walked down and back and it was a great turnout. So we were happy about that. And then the last portion of Norwalker is the active transportation and pedestrian infrastructure, and which I'll get into a little bit more. But we want people to walk, but we want to make sure that it's safe for folks. It's appealing for people to walk the area that they're walking in. So we really do whatever we can to partner with different departments to improve the walkability in Norwalk, which I'll get into in a sec. So I'm just going to go over a few things that we have been doing in the Norwalker program. So in the fall of 2022, we worked with the Department of Transportation, Mobility and Parking, TMP, to help fund street trees on Wilton Avenue to improve walkability in that neighborhood. So we were able to help fund some of the trees that were put in, and then TMP finished the Wilton Avenue, and it looks amazing. So we all know that street trees, it's beneficial for walkability because it provides shade, it improves the air quality in the environment, and then also perceived safety. So studies have found that people are more likely to walk in areas with street trees. And they also help slow cars down too in neighborhoods. So that's one area that has helped with the infrastructure in Norwalk. And then going along to the walks. So in 2022-2023 fiscal year, we've had 13 walks held. We kind of try to launch Walking Wednesdays where we would pick a map, a Norwalker walking map and walk, as well as partnering with different organizations. So we partnered with Merit 7 Corporate Wellness to do walks, I think for National Walking Day, which we did again, and then the Norwalk Public Library, and then the summer concert series. The turnout for these walks was much lower than, as you'll see recently. We had 48 attendees. So it was hard to get people walking after COVID. So we're still trying to work on that. And then in 2024, so far, we had 2 community walks held in partnership. The one that was in that photo, and then another walk before Earth Day in partnership with Norwalk Historical Society and Norwalk River Valley Trail, the NRVT. And we had 32 attendees between those 2 walks. So as you can see, much less, we're hosting less walks and getting such a better turnout. So we hope to keep this going and plan additional walks. We're currently working to walk before the summer concerts again this summer, if any of you are interested in, if anybody's interested in attending. I believe that is all I have. Those are our 3 programs that we have that are great. And if anyone has questions, please let me know.
If somebody had an issue with part of our walking series and felt that there was some not as well received areas of the walk, who do we have them contact?
Contact me. Is it from our Norwalker walking maps, like a walk that was held, or is it
It's one of the maps, and it's just
Yeah.
some area of the sidewalk is virtually, it's very dangerous, actually. I just want to make sure either our name isn't on that listing or we get it fixed.
Yeah, absolutely. So we have, if anybody has questions or any type of issues with the walking maps, that's something that we could take a look at, because we do need to, we're currently working to try to audit these maps again, because as time goes on, things do change. So yeah, they can certainly just let me know so we can pull that map temporarily until we get it fixed or whatever the case is.
Okay, thanks.
Absolutely.
Leah, thank you for this great information. I went on the section of the Connecticut, the Norwalk Valley River Trail by Riverside Avenue recently, and it's beautiful, the extension that was done over there across from the cemetery.
Yes. Yeah.
Yeah, up into Silver Mine. Yeah, beautiful. Yeah.
The missing link, I believe I think that's what you're referring to.
Yeah, the missing, yes.
Yep. Yeah. They just the NRVT is separate from the health department, but we do work with them and partner with them, absolutely.
Yeah.
But those maps, so the NRVT is a little bit different. But we do partner with them to do our walks and then also like support them if they're doing events and stuff like that. But it's all connected, it's all in Norwalk.
Yeah.
And absolutely, it's great work being done.
Thank you, Julia, for a great presentation. Just amazing work that you're doing. I love seeing all the pictures too, and all the happy smiles. Any other questions for Julia? Any other comments? Great. Thank you so much, Julia, for being here this morning to share that great work with everybody. So I just have a quick director's report. Just wanted to let everybody know, you may remember several years ago, I had asked you for your thoughts about me potentially joining the board of the Connecticut Association of Directors of Health. And you all were supportive, and you also wanted to make sure I had the time commitment to do it. So I appreciate the realism there too. But just want to let everyone know I'm concluding my current term as the immediate past president. And I'm going to be taking a break from the board. I'm not running again for election for a general position because I just want to take, at least a year off. But I just wanted to let everyone know that. So I'm concluding my term there, but to thank the board for their support. And it's been a great opportunity to, have that bigger picture look. And as you all know, the state health department and local health departments are closely linked together. It's, one public health system. So it's been great. Just wanted to let you all know that, and thank you again for your support. And then our last item on the agenda is public participation. I'd just like to remind everyone that the public comment is limited to 3 minutes, and it must pertain to an item on the agenda. So I'm going to ask if there's anybody from the public who would like to speak to please raise their hand right now for the opportunity. I don't see anybody with their hand. Oh, okay. All right, Diane. Aniela, can you let Diane speak?
Yes,
Right,
she's unmuted.
Ms. Larachella, good morning.
Yes, good morning, everyone. It's been interesting listening, especially to Julia's really great work and all the good work of this department. I'm in the process of doing some research related to how to file complaints. And when I saw the policies that are being have just been amended, I am hoping after my research is finished, I will just offer in writing to you, Director, and as well as Bill Mooney on the environmental health complaint policy. Of course, just some suggestions that you would take up with the board if you felt they were valid for Mr. Ehrlich and some of you others. I have over 30 years as a former senior investigator with the Department of Environmental Protection in the 80s in the hazardous materials management section. And then as a private sector consultant, much of what I do is file research and looking for complaints and then putting together, making a story about a particular company or facility or landfill by going into the records, the history. So I wasn't going to speak, but I decided I very much feel having history somehow retained in a safe way is so important to your work and enforcement of the very regulations that you uphold. So I'm glad that there has been some, of course, attention paid to this situation. I would like to just suggest, I think maybe Dr. Weinberger or maybe Ken had mentioned, if you could start looking at, or maybe there's already a the issue of anonymously complaining in the state back in the 80s. At times, someone from the public or an employee of a polluter would want to give information to the regulators, but they didn't want their name in the file because they felt it was either threat their job or their very life. So in the case of typical health department things, I would like to see if that policy could be enhanced or at least added to in the future, near future, to your your complaint policy. As far as file retention, I do believe also that at times people like me need to get our hands on this material easily and make copies so that we can then present a pattern or story of a bad actor, so to speak. While we don't have much industry in Norwalk, we know that noise is a pollutant. Sometimes people have HVAC.
Ms. Lauratelli,
Yeah.
you're over 3 minutes, so if you could just wrap it up soon. Thank
Oh,
you.
sure. I'm sorry. I'm so passionate I'm so passionate about this issue. I just wanted to say that I look forward to working with Mr. Mooney and you, Director, to try to ensure that these things that I mentioned are part of the fabric of your complaint policy and your file retention policy. It's so important, and thank you for addressing it.
Thank you, Ms. Lauratelli. Thank you for your feedback and your comments. Is there anyone? I don't see anyone else from the public. Are there, before we wrap up, anything else before we wrap up, before we adjourn? All right, if not, it is 8:45. We will adjourn the June 25th, 2024 meeting.